There are various causes of reduced hearing, and it's a huge burden, and we see it in this country. And so what we do is that we need to start what is called neonatal screening, which means what? A baby is born, and within 1 month, it's called the 136 rule, within 1 month of birth, we should be able to have screened a child with a hearing, for hearing assessment. And it's a very simple, straightforward test. It's a small machine that you put over the ears, and you send a signal into the ear, and you wait for a signal to be sent back. If the signal is sent back, then it means that the child can hear. Because obviously you can't ask a child, can you hear, when there's a scare?
It's an infant.
It's an infant. So you send a signal and you wait for a signal to be sent back. If you get back the signal, then you can confidently tell the parents that, hey, this baby boy, this baby girl can hear. If you don't receive a signal back, then you repeat the test after about 4 weeks. And if that fails again, you repeat you do a different test after 6 weeks. But basically, we aim to have a screening at 1 month and confirmation by 3 months. Hearing loss, as Sheila said, there are some causes that can be fixed with surgery and others can't. The ones that can be fixed with surgery, especially a cochlear implant. So when we look at hearing, mild hearing, moderate hearing, severe hearing loss. If you have severe hearing loss, we put in a cochlear implant. So a cochlear implant is a device you go under surgery. So take you to theater, put in a cochlear implant into your inner ear, close up, and 1 month later, switch on the cochlear implant. And then you undergo a very intense period of rehabilitation to teach you how to hear. Because you're assuming that when I have put this machine that you can hear. And as Sheila said, if you didn't know the sounds of birds before, how do you know that they're related? So after that period of rehabilitation, now you can hear. And to answer your question is that these cochlear implants actually do help those patients who have been well selected to hear. And it's fascinating because it is one of the only senses that can be lost out of the 5 that can be restored. How hearing happens is that you get sound coming into your ear, and what the ear does, it changes sound energy, which is just physical compressions, to electric signals. That's what a cochlear implant does. It changes sound energy to signals that are transmitted through the nerve into the brain. And the problem is that if you can't hear, the part of your brain that accepts hearing signals loses it. It's a concept called if you don't use it, you lose it. Therefore, there's a window period where if we don't implant these children, then if we implant them as an adult, they are not going to hear because the brain has lost that part of the brain. That part of the brain is not going to be able to interpret any sound or electrical signals. So we try as early as possible, and usually the magic number is below 6. And we do also get children between ages of 6 and 10 as well, who can still benefit from this. Maybe not as much as the younger children, but the younger the better. And usually we aim between age 2 and 6. That's the magic window, where we can implant and they can come back as able hearing. Yes. There are 2 types of adults. There are adults who have heard before, and there are adults who've never heard before. That's how we distinguish them in the hearing world. For the adult who has heard before, let me give you an example.
Yes.
You've been well, and you suddenly get a bout of meningitis, and you lose your hearing. and you put in a cochlear implant, you will hear. So that is one type of patient. The other adult is the adult who's never heard before, was born deaf, has lived their childhood as deaf, their teenagehood as deaf, and adult as deaf. That adult will not benefit from a cochlear implant because the part of the brain that is meant to hear, unfortunately, remember that concept, if you don't use it, you lose it. So that type of adult will not benefit from a cochlear implant. Yes.